Good morning. My name is Luana Paliti, birth operator, psychologist, psychotherapist, and together we will continue talking about women from intimate partner during the perinatal period. We will see some studies and also the consequences of violence on the mother, on the child, and also on the parenting relationship. First of all, a very important concept when we talk about perinatal violence, it is violence inflicted on the mother and on the child with consequences and risks for both of them. When we talk about a perinatal period, from the medical point of view, we refer to the 4 weeks before birth and the 4 weeks after birth. And this is certainly a very particular period. But here we are referring to the term in a wider sense. So we are referring to the period from pregnancy up to the second year of age of the child, which is considered as fundamentally important for health and also in terms of primary prevention. This is the period where the health of the mother and the child is promoted and also where the foundations are laid for the future health of both of them. And it is also the period where we can reduce problems and we can increase opportunities for the newborn and reduce risks. So it is important to act with supporting intervention. And we know that such interventions can be very important for the protection in the long term. As we've seen, there's a stereotype according to which pregnancy has a protective status versus violence. But anyhow, as we saw during the previous modules, we know that the data biased a little bit by the difficulty in asking for help, and so it is quite difficult to document violence. But anyhow, data show that the reality is different. Pregnancy is a time period of life where violence can start, it can intensify, and especially if pregnancy was not planned or desired. We do have protocols in order to intervene on different pathologies and diseases that might be a risk for pregnancy if there are complications and they refer to 10 to 20% of pregnancies. The World Health Organization, in its report of 2013, estimated that in the world, violence is the second reason for death for women from 15 to 44 years of age. Obviously, well, the numbers are small, but anyhow, the fact that it is the second cause for death for women during this period in their life where they are supposed to be healthy, well, actually, we should really think about it. We have to pay attention to this time period. When people become mothers and fathers, well, women and men live this experience as a crucial time in their life. The previous balance changes. It is a critical time because it entails very deep changes from all points of view. Well, we know that the results should be enriching. It is a chance for growth. But of course, a lot of energy is needed in order to create space and room for the new child. But the emotions that people feel don't always match with the predefined idea of being mothers and fathers. people might feel that there's a lack of support or a lack of sharing, even if pregnancy was desired, even if it was planned, even if there is a positive involvement by the couple. Many studies show us that with the involvement of the father, the psychophysical health of the child and the mother improves, and also the risks during pregnancy are reduced, and also the risks of labor are reduced, and adaptation is facilitated. So in couples where this protective involvement is insufficient or lacking, and when there is violence in the relationship with the partner, well, there is a bad feeling, there is a malaise that will obviously affect the life of women during pregnancy. And therefore, the feeling of alert and fear will be the prevalent fear and the prevalent feeling. According to some studies, pregnancy, just like some other events that create some limitations for women, are associated to increasing risk of violence, just like separation, for example, or like having to leave their job. So these are moments which are considered as moments at risk. Many studies focus on physical violence. Obviously, pregnancy makes for women very difficult to defend themselves if they are assaulted. And the results of physical violence during pregnancy lead to hospitalization that is double-fold compared to women who are not pregnant. So the fact of staying at hospital gives is a possibility to identify the violence that these women are affected from. And often in these situations, women don't want to be dismissed from the hospital. They are quite insecure. They show to be insecure when they have to leave the hospital. And some studies also show that there's slapping, pushing, punching on the genitals and also on the abdomen. With regard to sexual violence, pregnancy might be the result of one or more episodes of rape. Well, we know that early pregnancy very often is associated to sexual violence, and young women won't ask for abortion. And having a child that is the result of a rape will have some consequences we need to act for. We need to offer support also after the birth of the child. Some authors say that there's also a secondary effect of this form of violence, that is to say the perception that mothers have related to the personality of the child. They expect the child to be affected negatively by the abuse suffered during pregnancy, and also negatively affected by the personality of the father. And with regard to other spheres of sexual life during pregnancy, there might be some fear of the mother that is forced to have sexual relationships, and also the vision of porn. And violence might be characterized by submission, isolation, but also criticism and denigration. Constant criticism and denigration. And and also the fact that medical examinations are not carried out, or they may cancel some meetings or medical examinations. This is something that could have a negative influence on the health of the mother and the child. And this is due to the fact that the woman is forced to live separated from their social life, isolated, and this is quite common for women who are victims of violence. This type of violence obviously doesn't allow mothers to have the right representation of themselves as a mother. And anyhow, physical violence, psychological and sexual violence are always present. All of them very often from intimate partners, but some authors say that very often the different forms of violence are not identified, they are not clearly identified, and being different, they can have different results. Well, we know that the physical violence is the one that can have the most severe consequences on the health, or more visible consequences on the health of mothers and children. But if the mother is, the woman is also a psychological violence victim, this will also have consequences on physical health, because, well, she might start drinking alcohol, smoke, abuse of substances as a consequence, and then we also have consequences related to stress on the development of the child, the fetus and the child. On this slide, here we can see some examples of some behaviors of the abusive partner that wants to control, wants to limit access to prenatal care, or also blaming the woman for her physical changes during pregnancy, for her unattractive physical appearance, or also, well, he tries to control some choices like the doctor she should refer to, the hospital, and also how birth should occur, and also interference, well, control related to childcare. For example, the partner will check and invalidate her opinions about the child on breastfeeding. Help from the family members are denied, or is denied, or imposed. So it is a very controlling behavior from the partner, and sometimes we could detect it if during a medical examination or during an interview, it is the partner always talking instead of letting the woman speak. And also, the partner might force the woman to stop work during pregnancy, to stop working during pregnancy. This might be let's say, symptom of an abusive partner, as well as also economic violence. So the woman will have limited access to economic possibilities, and again, also from this point of view, the partner will act in a violent way. Let's now have a look at the consequences, based on studies and what studies tell us. Let's have a look at the consequences of violence on the mother and on the child and on the parental relationship. As we've seen already, Violence has negative consequences on pregnancy in a direct and indirect way. So we have the effects of trauma, so a higher hospitalization rate, and violence might be associated to chronic diseases worsening, like diabetes or hypertension. This is due to stress, and also it is associated to psychosomatic problems. We know, thanks to neuroscience and thanks to neurology, we know that but increasing the rate of stress hormones, we have a change in the ability to respond to danger. And during pregnancy, this is very risky because it hinders the release of oxytocin kinds, that is fundamental for breastfeeding, and also it is fundamental in order to have a good connection with the child. Actually, we will see this during module number 3, but this is fundamental, that is to say, the action of stress on this life period. With regard to the effects on the baby and on the fetus, we may have retardation in prenatal care. We've seen that many women go very late to medical examinations, or some examinations are forgotten, even cancelled. There could be a lack or a lower medical care. And another effect is that there's a high number of children, newborns, with very low weight. And also early birth, preterm birth, and also the most common pathologies are present at a higher rate. The condition of continuous stress and continuous fear for women during pregnancy also has effects on the development of the child. So the increasing production of stress hormones might cause damages, like, for example, reduction in oxygen and preterm birth, as we said. And many studies showed that high cortisol levels in pregnancy have long-term effects also. For example, low birth weight, increase in preterm birth, increase of spontaneous abortions, accelerated development of labor, altered fetal heartbeat, and also a different temper, also at 4-6 months of life of the child. In the long run, there is a correlation of a predisposition to hypertension, disturbance in attention at 18 months, cardiovascular problems, and type 2 diabetes. So many studies show that high levels of cortisol have very long-term effects, and the child might have epigenetic mutations in the response to stress, and she could be a victim of the violence suffered by the mother. With regard to the consequences on the psychological health, in cases of violence with an intimate partner, obviously, clearly, women that are chronically exposed to violence, they they will be vigilant all the time, alert, or there might be anxiety disorders, terror, experiences of powerlessness, pre and postpartum depression, for example. There are many studies showing the correlation with the pre and postpartum depression, indeed, with, well, again, as I said, feeling of having no power, very deep status of anxiety and terror. As we have seen, this will also mean that the woman will not take care of herself, of her body, and of her pregnancy. But of course, this has some consequences also after birth, because the woman will have difficulties in creating attachment with the infant. For sure, the mother will be less available to creating attachment, and the mother will feel very bad, and this does not facilitate the possibility to get into a good relationship with the infant. Many authors also say that if these women leave the violent relationship also after the birth of the child, there are possibilities to recreate a good balance of the representation of herself as a mother, and also the ability to create attachment with the child, safe attachment with the child. Anyhow, very often these women will collect a lot of diagnoses like hypochondria, panic attacks, depression, or very often they take drugs and medicines. They are not efficient. Why? Because the trauma is not identified or recognized. Well, this is why there is a proposal to have a different diagnostic category in order to identify the symptoms of those women who have undergone chronic trauma that is different from post-traumatic stress disorder that develops in people that have experienced or witnessed a short time trauma. But instead, post-traumatic complex post-traumatic disorder is a characteristic of those who live long-term trauma, and therefore the symptoms are different. And also, the connection between pregnancy, violence, and the risk of abuse on the children. This is quite well known. So the partner who abuses the pregnant mother is likely to have violent behavior with the children in a percentage going from 40 to 60%. And abuse from the father is quite likely if the mother is a victim of violence from the partner. This is according to WHO. So the children who live in a violent family are at a higher risk of direct abuse and violence. And these children might develop some emotional disorders that might lead them to become violent. or to be victims of violence in other contexts. So this type of violence has been associated also to high rate of mortality of newborns and children due to malnutrition or diseases. Some other data show that violent fathers, if they spend time with the children, the more time they spend with the children, the more chances for the children to be violent themselves. While antisocial behavior from the children in the children are reduced if the parents separate or divorce. And even if the violence is not direct on the children, their needs are not taken care of because the competencies of their mother is damaged. Abuse might weaken the response by the mother, and the mother might be deprived of energy in order to focus on the needs of the children. As a consequence, there might be a feeling of insecurity, fear, and therefore, even if the aggression does not occur at the presence of the children, the climate, the general climate and atmosphere that is generated is, of course, perceived implicitly by the children, and it becomes a traumatic memory. So this is even different from assisted violence. Assisted violence, which is direct violence, a form of violence from the moment the children are in the womb of their mother, but also when they are still very small, very young, because they fine-tune with the emotivity of their mothers. So even if a direct aggression, the effects that get to the children are direct. With regard to risk and protective factors, well, first of all, gender violence is very widely spread. It doesn't depend on the social context, ethnic group, or culture. With regard to individual factors, so also related to socio-demographic characteristics, is that undesired pregnancy is at risk of violence, just like a young age also is at a high risk of violence, and also the fact of being victims of violence during childhood, even as assisted violence. These are factors that expose to the risk of being victims of violence inside the family or inside the couple. Also, women who have a history of violence from their intimate partners before pregnancy, they have a higher probability to be victims of violence during pregnancy. The situations of stress that women might live during their life might lead to violence. For example, histories of violence, or if there are some particular individual characteristics. With regard to the relationship, so at a relational level, the controlling behaviors or jealousy of the partner, male partner, this is connected to violent behavior, and obviously if there is a good balance inside the couple, well, there are less probabilities to have violence, of course. With regard to community level isolation or the lack of social support, this is a clear sign of the fact that there is violence inside the couple. So quite clearly, this is a factor that expresses risk, the presence of risk. Well, it shows that the woman might be at risk of being subjected to violence. But then there are also some studies that study the social level, the fact that there might be the presence of neighbors, or there might be an environment that promotes or prevents violence, such as social and cultural norms, gender roles, legal and political level. So also the social level might play a role with regard to the presence of violence against women. So actually there are not many studies showing violence or studying violence from the social point of view. The acceptance of gender hierarchies or hierarchical behaviors inside a society, this is a risk factor for violence against women. With regard to protective factors, the possibility to make information available, this is very important, information on how to be helped and which services might support women who are victims of violence. This is all from me. Thank you.